Hello. Delirium is a change in brain function that often occurs in response to illness and can also occur during alcohol or drug withdrawal. It can come on over hours or days and is a temporary state where the person is unable to interact and engage with their environment in the normal way, perhaps appearing disoriented or confused, drowsy or agitated, and sometimes moving between the two. Sometimes the signs can be somewhat more subtle, with elements of confusion or indeed unusual aspects of thinking or behaviour that aren't typically characteristic of the person. Anyone who is medically unwell can experience delirium, though it's more commonly seen amongst older persons and is often seen in hospital settings. It's particularly prevalent amongst patients who are critically unwell, which is the setting that I work in. There are a number of things that can put someone at risk for developing delirium, including physical factors like dehydration, illness, sleep deprivation, the effects of medication, poor nutrition, constipation, infection, and so on. There are also factors specific to the person. These can include age, frailty, and known cognitive impairment, but also things that can be remedied, like needing glasses or hearing aids. The key aspect of good delirium care includes detecting it when it's there, understanding what's driving it, and addressing the underlying cause or causes and then working to resolve it. There are no medications to treat delirium, though medication is sometimes used as part of the management if needed. Delirium can be distressing for both the person themselves and for their families and loved ones who might not understand what is going on. Those experiencing delirium can have frightening hallucinations. They can become fearful or even paranoid about the people around them, sometimes feeling that they are in great danger. When someone is delirious, it can be difficult to convince them that these things aren't real. The best thing to do is to find other ways to help them to feel safe and reassured. Each person is different, but key things that are generally known to be helpful in supporting someone with delirium, and these are things that can also help to resolve delirium, include gently reminding them where they are and what's happening, having loved ones by their side and ensuring that they understand what's happening for the person, making sure they have glasses and hearing aids if normally needed, supporting eating, drinking and moving around if safe, and supporting sleep. If the patient is in pain, it's also very important that this is appropriately addressed. The very nature of delirium is that it can come and go, sometimes really only showing itself at night and largely resolving during the day. This is normal. Usually, as patients get better, delirium resolves, but it can take some time. If it gets worse, it can be a sign of an underlying problem, and therefore any change in how alert or confused a person who is known to be physically unwell should be followed up by a medical professional. People may have a hard time understanding what has happened after delirium and can particularly struggle to get a sense of what was real and what wasn't. Helping people make sense of their delirium experiences always starts with understanding what was happening. That is, naming and explaining it. Joining with the person to talk through their experiences and gently start to make sense of them is more helpful than arguing or dismissing. In time, most people will come to terms with their experience and make a full recovery.